And as Ontario moves to reopen with vaccinations on the rise and cases on the decline, one very important area has not yet eased restrictions. Hospitals across the province are still blocking many families from being together with strict visitor limitations. Dr. Michael Warner joins me now with more on why this policy needs to be updated and soon. Good morning, Dr. Warner.
Good morning.
So let's talk a little bit about that. You called and said it's time for hospitals to update their visitor policies. Tell me a little bit about why it's time to do so. And you're talking about province-wide too.
Well, over time, hospitals have loosened their visitor restrictions, but I would argue that it's not enough. So right now, certain categories of patients can have more visitors than others. Perhaps, if you're at the end of life or if you're having a baby, you can have more visitors than, say, if you're coming to have a knee replacement where you can have no visitors. But in fact, even at hospitals within Toronto, there's heterogeneity in terms of what the visitor policies are. And I would argue, given that there's such low COVID prevalence in the community, we are firmly in the vaccine era where most healthcare workers, visitors, and patients are vaccinated, that the current restrictions really don't make scientific sense because we've been able to keep hospitals safe even when there were no vaccines. And now that we have vaccines, it's time to open things up because of the benefits for patients and healthcare workers.
Let's talk about these benefits. You talk a little bit about the impacts that of easing these restrictions will have, not only on the patients, but also the families and healthcare workers. Can you talk a little bit about that?
Well, I think for patients, first and foremost, it's really helpful to have an advocate at the bedside, someone who can speak for you if you're too unwell to speak or if we don't understand the first language of the patient, someone to tell the patient's story. Even someone to provide care. I mean, in hospitals before COVID, families would participate in rounds in the ICU when we make decisions for patients. They can feed patients. They can provide physiotherapy. There are touch points for communication throughout the day with the healthcare team when families are present, as opposed to having a phone call once every day or once every other day. I actually think patients get better care when there's someone there beside them advocating for them. And as a healthcare worker, it feels much better to be able to understand fully what your patient is all about because you can hear their story through someone who loves them. And it makes the job that I do much more enjoyable because I feel like I'm caring for a person as opposed to a bunch of numbers and lab tests.
Yeah.
And then finally, I think there are people who are not seeking care because they're afraid of being alone in the hospital. And we're seeing later presentation disease. And I think that's a significant risk.
That was definitely one of the questions I was going to ask you. An important and interesting note that you made in your video saying that might encourage people to come and visit and get that care that they need before, because you're seeing a lot of late presentation.
Absolutely. And I think that the policies are somewhat confusing for people because as a fully vaccinated person, I would not be able to visit my fully vaccinated wife unencumbered, yet an unvaccinated healthcare worker could be with them for 12 hours providing care. I'm not saying vaccines should be mandatory, but I'm saying that we need consistency across all domains. As the province reopens, and as a healthcare worker, I'm telling people there are benefits to getting vaccinated, we have to make sure that things are consistent within the hospital, where we are the experts and we can do things safely, whether you're a vaccinated visitor or an unvaccinated visitor.
Okay, Dr. Michael Warner, thank you so much for joining us this morning, and thank you for all the work that you do.
Thank you.
All the best. Time now, 8:09 a.m. Let's say good morning to Stephanie Henry.